Are you a new mom struggling with sore nipples? In this video, I'm going to share some strategies and tips on how to make breastfeeding more comfortable and reduce nipple pain. 1. What is the most common cause of sore nipples during breastfeeding? The most common cause of sore nipples during breastfeeding is an incorrect latch. When the baby does not properly latch onto the breast, it can cause friction and pain for the mother. Poor positioning can also contribute to nipple soreness. 2. What are some tips for preventing nipple pain while nursing? Start off by gently massaging your nipples with lanolin or coconut oil before each feed. This will help to keep the skin on your nipples soft and supple, which can decrease the likelihood of pain. Use a breast pump prior to nursing if you find that your nipples are sore. This way, any hardened milk in the ducts can be expressed before nursing, which will make latching on easier. Try different positions when breastfeeding. Some positions may be more comfortable than others. Experimenting with a few different ones can help you determine which one works best for you and your baby so that nipple pain is minimized. Make sure that your baby is latching on correctly to avoid further discomfort. If you are unsure how to do this, speak with a lactation consultant who can show you proper techniques for latching and positioning your baby, as well as help you identify any potential problem areas. When finished feeding, apply a cold compress or ice pack to the nipples for 10 minutes after each feed. This will help to soothe any discomfort. Talk to a doctor or lactation consultant if you are experiencing pain while nursing, as they may be able to provide more specific strategies for relief. 3. What are some home remedies to soothe nipple pain? One of the best ways to soothe nipple pain is to apply a cold compress or ice pack. You can use a cloth soaked in cold water, or even a bag of frozen vegetables, and gently press it against your nipples for around 15 minutes at a time. This offers relief from soreness and helps reduce inflammation. Using lanolin cream directly after breastfeeding can also speed up healing and provide relief for any discomfort you may be feeling. Applying a moisturizing lotion like coconut oil on dry patches can also help heal cracked skin. It's also important to make sure that baby is latching correctly. If not, adjust their positioning until they latch properly. If this doesn't work, you might want to consider consulting a lactation specialist for more advice. 4. When should a breastfeeding mother contact her healthcare provider about sore nipples? If a breastfeeding mother experiences pain that is not relieved after following the above strategies, she should contact her healthcare provider. Pain caused by an infection such as thrush may need specific treatment, and in some cases, medical intervention may be necessary. In addition to consulting her healthcare provider if severe nipple pain persists, a breastfeeding mother should also seek advice on any other issues related to lactation that may arise. With proper guidance, a mother can continue breastfeeding comfortably and safely with minimal discomfort. By taking steps to reduce soreness before it becomes unbearable, a mother can ensure that both she and her baby are getting the most out of the nursing experience. It is important for mothers to know their options when it comes to dealing with sore nipples so they can make informed decisions and find relief. With the right support, mothers are more likely to successfully breastfeed their babies and enjoy the experience without any pain or discomfort. 5. Are there any breastfeeding positions that can help reduce nipple pain? Yes, certain breastfeeding positions can help reduce nipple pain. By switching up the way you hold your baby to breastfeed, you may be able to find a more comfortable positioning that reduces discomfort. For example, try laid-back breastfeeding, which involves having your baby in a reclined position with their head and body supported by pillows. Or you can also try side-lying breastfeeding, where the mother and baby are lying on their sides facing each other. If none of these positions work for you and your baby, it is important to talk to a lactation consultant for personalized advice about what works best for both of you. Additionally, making sure that your baby has a good latch is essential in order to avoid nipple pain. The good latching technique involves making sure that your baby's lips are everted and that the chin is tucked in. If your baby's latch is not correct, It can cause discomfort for you and impede your child's ability to get enough milk. It is also important to check on both of you periodically while feeding to make sure everything feels comfortable and relaxed. 6. How can a new mom ensure she is correctly positioning the baby for breastfeeding? A new mom can ensure her baby is correctly positioned for breastfeeding by using the following steps. 1. Place the baby facing you, with their whole body supported in your arms and close to your body. 2. Position your breasts so that the nipple is pointing slightly upwards towards the baby's nose. 3. Make sure that your baby's chin and lower lip are lined up directly beneath the nipple, and his/her mouth should be open wide enough to cover most of your areola, the pigmented area around the nipple. 4. Support your breast with one hand by making a C shape with your thumb and index finger, while cradling and supporting the rest of your breast with your other hand. 5. Bring the baby to the breast, not the breast to the baby, and ensure that the baby's lower lip is everted outward so that their tongue can reach down under your nipple for a good latch. 6. Gently compress your breast when you see that your baby's lower lip is extended outwards. This will encourage them to open their mouth wide enough to cover most of your areola. 7. Use 1 or 2 fingers on the side of your areola opposite from where the baby's chin is resting to help keep it away from blocking the milk ducts, which may result in blocked milk ducts and mastitis breast tissue infection. We hope this video has given you a better understanding of how to correctly position your baby for breastfeeding. We know that it can take some practice and patience, but the right positioning will help ensure both mom and baby are comfortable during feeding time. If you have any questions or tips about nipple pain relief strategies, please leave them in the comments below. Be sure to like and subscribe if you found this helpful. We'll be posting more videos with expert advice on motherhood soon.